Our research presentation is on the investigation of vaccination timing and the incidence of autism. Our primary literature is titled Measles, Mumps, Rubella Vaccination Timing and Autism Among Young African American Boys, a reanalysis of CDC data by Brian S. Hooker et al. They hypothesized that the timing of the MMR vaccination plays a major role in the incidence of autism, and look at 3 areas of data, including 0 to 18 months of age, 18 months to 24 months of age, and 24 to 36 months of age that the cases were vaccinated. And they also focus on differences in results based on specific gender and race groups. So where did the whole idea that the MMR vaccine is related to autism come about? Well, the Wakefield et al. Study, conducted in 1998, first hypothesized this link between MMR and autism. It looked at 12 cases of autism, 11 male, 1 female, all at different ages, and found that there was indeed a correlation between autism and MMR vaccination. However, further research shows that this correlation is based on selection bias and pure chance association, as proven by the Farrington et al. Study conducted in 2001. Also, parents and physicians likely link this incidence of autism in all 12 cases to the MMR vaccine.
I'm sure everyone knows what autism is, but in our paper it was defined as qualitative impairments in social interaction, qualitative impairments in communication, and restricted and stereotyped patterns of behavior, interests, and activities. Children with autism suffer a loss of previously acquired skills suggestive of neurodegeneration or a type of progressive encephalopathy, with a pathogenic basis occurring after birth. 1 in 68 children have autism, and they're diagnosed through a series of behavioral indicators. There is no way to do blood tests or MRIs. It's just based off of their behavior, and 62% of children with autism experience a period of regression, and that is often between 18 to 24 months, and that is indicative of the MMR because that period would occur right after getting the MMR vaccination.
So when do you get the MMR vaccination? The first dose, it's delivered in 2 doses, but the first dose is administered 12 to 15 months prior to the period of regression of autism, interestingly enough. And the second dose is 4 to 6 years of age. Another factor that our paper discussed was the presence of thimerosal, a mercury-based preservative in the vaccination. Our cases included children born within the years 1986 to 1993. However, thimerosal was removed in 1999 based on suspected health complications, but it was still included in these vaccinations during our study. And it also just poses a possible threat to our subjects in general. The Geyer study was conducted soon after the removal in 1999, and it proved that there was a correlation between thimerosal and autism.
So in the study, the experimenters collected data from the CDC, and it included vaccination history of when the children received vaccines, and also included demographic data, including their race, different, like their birth weight when they were born, and just different factors like that. Our sample size consisted of 624 children, and they're all from the metropolitan Atlanta area. And there are also 1,824 controls. And the children who are included in this study were all born between 1986 and 1993. And they basically just compared the data and looked at the timing of when they got the vaccine and compared it to whether or not they had autism or not.
So some terms we would like to define before looking at our results include the p-value, which is defined to help to determine the statistical significance of the results. It is essentially the probability of obtaining the observed sample resulting from the significance level. And our significance level in this study is 0.05. Another term is the 95% confidence intervals, which is defined as the percentage of all possible samples that can be expected to include the true population.
Relative risk is the likelihood of getting autism, and they looked at multiple factors, including the different age cutoffs, as well as they compared gender and race. The 3 different age cutoffs in this study are 0 to 18 months, 18 to 24 months, and then 24 to 36 months, of which is when they received the vaccination.
So in this graph, we're looking at the relative risk versus the age of the total sample population. And you can see here that the different ages at which they were vaccinated, 0 to 18 months, 18 to 24 months, 24 to 36 months. And the only statistically significant piece of data in this chart is the 24 to 36 months, which shows a high level of incidence of autism, relative risk, and is statistically significant because it has a p-value of 0.028. This next chart was looking at the relative risk versus age of male and female. And interesting enough, there was no statistically significant results from female data, but however, the only statistically significant result was in males aged 24 to 36 months with a high level or high incidence of autism. And then finally, our study looked at the relative risk of autism versus the age of African American and white subjects. So once again, the only statistically significant piece of data was African American males aged 24 to 36 months at vaccination. And it was the highest correlation between the age of vaccination and incidence of autism.
So based off of all of these tables, it's clear that as the age of a child is later that they receive the MMR vaccine, it increases the likelihood that they will have autism, so that relative risk is greater at greater ages of vaccination. Other factors that our primary literature discussed that could also be affecting the fact that they're getting autism are low birth weight, and so the lower birth weight they saw was also a factor in the higher risk of having autism. They also, again, discussed the thimerosal because that was in the vaccines during that time period, so that could be a possible factor as well. And interesting was what they talked about with the vitamin D deficiency. And African American skin type are unable to absorb vitamin D as well as white people's skin, and so they considered that a possible factor which could have led to African Americans having a higher risk of autism. And they also discussed that in their study, there were children that were included in their data that were around 3 years of age, maybe a little bit younger, and that could possibly have skewed their data results because children can only be truly diagnosed between the years of 3.7 to 4.2 years of age. So those children that were included in the study that were younger than that possibly could have skewed the results. So those are just some of the things that they discussed in that part.
When comparing the results of our study to another study titled The Time Trends in Autism and an MMR Immunization Coverage in California, they were looking at a graph with steady exponential increase in the incidence of autism from the years 1980 to 1994, whereas at the same period of time, there was a constant level of vaccinations being administered. So that just goes to show that although there was an increased diagnosis of autism, there wasn't an increase in vaccinations. So this could be because there was an increased awareness of autism later on in the the 90s it became more common, or it could be due to changing diagnostic criteria. Some children may exhibit certain behavioral patterns, but that they weren't diagnosed with autism. And another factor could have been environmental factors in general.
So in conclusion, based off of our paper, obviously it very much stressed the timing of when vaccinations are administered, and so it's very important to know when the right time is to vaccinate children, where it is safe for them, and so obviously we found that it's better to vaccinate them earlier because around the 24 to 36 month it became a high risk of getting autism. So this could lead to timing regulations and better administering these vaccinations, and as well as just vaccine precautions in general, just knowing that there are things in these vaccines that could possibly lead to disorders, as well as prenatal care. It leads to continued research and just making sure that the prenatal care is taken care of, because those were potential factors in autism. However, our primary literature was not widely accepted in the scientific community. There were not a whole lot of other pieces of literature to back up what this article discussed and their results. And in fact, we found out recently that this primary literature was retracted. So based off of these results, they're still very important in what they found as far as the correlation between race and autism and the gender differences between autism, that children are more likely to develop autism as male and African American. So although this paper was retracted and the results were between connecting the MMR vaccination and autism weren't necessarily supported by other scientists, it does show important results in the correlations. And so we just, based off of this literature, it's definitely important to continue the research and continue searching for the answer of what causes autism, and also just finding a cure.
Thank
And
you.
these are our references. Thank you.